Medical Association challenges a practice used to treat breast cancer for decades. It claims surgically removing lymph nodes from a patient is, in many cases, unnecessary. The procedure can also lead to painful swelling for those who undergo the surgeries. So now what? For women hearing a lot of different information from a lot of different studies, how do we know what is right? Dr. Allan Magaziner from the Magaziner Center for Wellness is here to tell us exactly what we need to know. So I first looked at the study and I said early stage breast cancer, 900 patients. How viable is this study?
I think it's pretty viable because, truthfully, this was published in JAMA, the Journal of the AMA, but there was a prior study published just a month ago in the New England Journal of Medicine which showed very similar results. And what they found is that those people with certain type of breast cancer, especially early type of breast cancer, which is about 20% of the people with breast cancer in general, may do just as well to have just what we call a sentinel node removal or dissection, which means just the one lymph node near the cancer to be removed, compared to those who were getting previously what's called the axillary lymph node dissection, which is multiple lymph nodes to be removed. The ones who are having the multiple lymph nodes, the axillary dissection, they find that they're often in a lot of pain afterwards. There's swelling, there's tenderness, sometimes permanent either numbness or even what's called lymphedema, which means swelling. That really doesn't go away very much.
So if we're focusing on people with the early stage, do we have to take into factors like age, like family history, and things like that when you go to your doctor and you say, you know, what should I do?
Well, absolutely, but what happens here is the doctors tend to do what's called a biopsy first of this sentinel node. And if it's a particular type, it's called the T1, T2, is what you should talk to your doctor about. If it's that type, these people may do just as well as far as survival and recurrences compared to those who are having most of the lymph nodes removed from the armpit area.
So what about people that are past that early stage? Because there are plenty of people that find out and they're in stage 3 or stage 4 breast cancer.
Those people may need more invasive procedures done. But you know, we're moving towards a trend of less invasive therapies. For example, back in the 80s, we started reducing the mastectomies and started having more lumpectomies to be done, followed by radiation. So now we're looking at maybe reducing the amount of invasive procedures to the lymph node dissection as well.
Okay, really quick, I have to ask you about another new study that came out today. And this was from the University of Miami. Diet soda increases the risk of heart problems and stroke.
Well, I've been telling people this all along. Stay off of those things. You know, I'm still wondering, what type of food is diet soda? Does it have any protein? Is it a carbohydrate? Is it a fat? It has none of these beneficial properties that we really need when we're ingesting food or drinking beverages. So I tell my patients, stay off the diet sodas. Not only may increase your risk of heart disease and stroke, but also increase your risk, believe it or not, of diabetes, hypertension, and it may even increase your appetite. There's certain centers in the brain that aspartame and other diet substitutes may actually stimulate appetite.
Well, then that's one can a day, right?
You should stay away completely, in my opinion. Drink water instead.
All right, Dr. Allan Magaziner, thank you for that. Thomas, I'll send